Do you
Okay.
want
And
me
we'll
to?
get you notes, Cully. You'll get notes, okay? So you're not on your own for that part. So Miriam will take notes, right? And then I'll have some notes too. So we'll get them back to you before you have to report
Okay.
out, okay?
Okay.
All right, so that's good. We took care of our mechanics. So now let's kind of go back to
Do
our
you want me to
content.
share my screen so we can see what I'm capturing or no?
Yeah, that's a nice idea, Miriam, because we're small enough that everybody should still be able to see each other if you don't mind doing that.
No problem. Okay.
Okay,
Here we go.
so that's great. And so
Just
as
need to eat
Miriam
a little bit of
setting,
cottage cheese. Okay.
that's
Sorry.
fine. You can eat your
All right.
lunch, no
Okay.
problems. Okay, everyone can
With
eat, do whatever
blueberries.
you need to do. Okay, everybody's getting used to, like I said, someone was all worried the other day because they were afraid of showing their animal. And I was like, I think the rules have changed. Like, it's fine that you have your animal in your garden and all these things now. Okay, so the idea here again is we have three big areas: content, funding, and sort of synthesis, like the most important things for the three of you. And the idea was really to think about basically Raise Up Oregon, which was set forth, as a plan through 2023 as a 5-year plan. And just, I know Miriam and Sue have this memorized. So Cully, if I am reviewing things that are really in your heart, you tell me to stop talking and we'll just plunge into the content. But right, you had the three goals around children arrive ready for K, children in healthy, stable, attached families, and the early learning system as aligned, coordinated, and family centered. You have the 5 sectors that come together. So early care and education, Miriam's shop, human services, housing, health, and K-12. And then there were the 14 objectives and then 6 core values. And I'm going to just remind people of what those are, because one was equity and cultural responsiveness. Second was enlisting and empowering family voice. Third was being cross-sector within the totality of the early learning system. Fourth was developing collaborative relationships with communities. Fifth was continuous improvement, especially through professional development of staff. And sixth was using data to make decisions and to measure outcomes. And so with that as background, I mean, let's open it up maybe to the first one, which is thinking about where you are now. What do you see as content priorities basically for the next year and by 2023? And in the handout, we gave a couple examples. So they could have been, positive changes that some of which have been reported on, right, by the agency directors today, behavioral health focus, a sustainable governance model, professional learning for the workforce. Those are some potential examples that could inform your thinking about content priorities. So who wants to kick it off?
I have a question, Miriam. I was thinking when they talked about the integration of the different sectors, it occurs to me like they're all there at the council meeting regularly, which is great. But Margaret, I think it was Margaret, commented on wanting to learn from the division, which made me wonder how integrated are the systems at the policy level and maybe training as well. And do you feel like, I don't know, I'd love to hear from you in terms of, because I think the vision was for greater integration, not just being present. And I can't tell if that has happened or not.
Yeah, thanks, Kelly. I think that's a great question. I would say, not very. I think and when it is, I think it's like more project or initiative driven, right? And we have some wins on that too, right? And so it's not like there hasn't been. And I think RUI Act is making sure that there's sort of more communication on an ongoing manner. And, Sue, you may, have also a point of view on that with RUI Act. But I mean, I feel like improvements and ongoing communication, I think around it, like shared North Star, I think it's been proven probably helpful as well during COVID to get more of that sort of communication needs in real time around the different impacts. And so that has lent itself, I think, to like it being project or initiative driven. But to me personally, I feel like I'm just going to throw it out there that some of that work is going to start to have to happen in how we better define the regional and community partners of each of these sectors and have like some, think about our levers to make sure that there's like actual bi-directional accountability around communication and kind of alignment. Like, I guess when I just think about it, like, and again, there, some better than others. Hubs have made a difference, certainly in that region, particularly probably with CCOs. I mean, I know Margaret and I have talked like in passing about, you know, community action agencies. I think at one point this year I'm not sure if I may still, if this has happened or if it was canceled, I can't remember. I was going to speak to the Community Action Agency Association. They're like the primary partner of housing and community services. So I don't know if that helps at all, sort of kind of, I think more work probably needs to be done there.
So Miriam, I think you were saying, so RUIAC has allowed the agency staff to speak with one another more in a more positive manner.
Mm-hmm.
And it has resulted in some projects being more shared.
Yeah.
But actually, yeah. I think you might have said there are two opportunities. One is at the level of your community level work, right? And to assure, so one thing would be to actually figure out a better strategy for unification or alignment with your community work. And the other one, I think, maybe is also at more also almost of like organizational decision making within the state agencies, because I think, Cully, like the RUIAC people that has been a general success, I think people would say, and they are exchanging information, but that is different from interdependency in their decisional process.
Mm-hmm.
Yeah, right. I think both of your comments are really right on, Miriam and Harriet. And my perspective, Cully, is that there are lots of conversations between Miriam and Colt, or Miriam and mostly Colt, but also Miriam and Pat. And it is sort of, on the issue, as an issue arises, that they need to connect on, especially in this COVID world. So I don't know if that's helping set up a basis by which, looking down the road, we'll be able to establish better communications that are sort of expected and built into the system. Right now,
well, it feels like,
yeah, it's just a time, I think it's pretty much a time issue right now. Everyone's just trying to stay ahead of this COVID curve.
it seems though, one thing that I thought when I was listening to Margaret and then just listening to you now, Miriam, I think maybe an opportunity is specifically integration around equity practices and policies, because I think that the early learning division has set some frameworks around equity and partnership with community. And I mean, even just having the equity fund, like there's so much that has happened where there is the conscientiousness and intentionality around how do we support diverse children and families that you don't see at those other agencies. And I've walked through this COVID experience a little with Pat and OHA, and they have a lot on the books, but they had very little relationship with any CBOs. They had very little understanding of how to operationalize some of the, and Pat would say this too, I've said this to him, so I'm not speaking out of turn. And I'm speaking, I guess, my experiences working with him with the Black community, he's super open. Relationships weren't there, processes weren't followed that really centered equity, and he admitted that. And I think, gosh, is there a way that the early childhood space could be a guide to others who are touching children who don't know how to do that piece of things? And I don't know, I don't want to create more work for you, but I think that your agency has been able to implement, not just have things in policy, but implement practices and sort of a theory of action around how you engage communities that I think OHA is the only one I've sort of been close enough to, but I would say DHS is on that learning curve too. I have been in some of their meetings. It's fortunate that they've hired some diverse folks, which has helped, but I don't know. I wonder if there's an opportunity there. And then if that alignment happens, then maybe, because you said something about community organizations and who's on the ground working with kids, if that was shared as well, it might just make more of a seamless system of service delivery.
So Cully, is it
Thinking out
one
loud, this
thing,
could be a terrible idea.
Cully, would one way to articulate this be that the next step would be unification alignment at the agency level, selecting a core policy area such as equity, right, to actually create that alignment?
You're on mute, Kali. Oh, there you go.
You mean what you wrote on here?
I'm suggesting a second content under that one. It could be, it says where after centering, or Miriam could add to the first one, that would not just be at the community work partner, but also at the level, Miriam, really of the decisional processes within the agencies to pick a core issue. Do you see what I'm saying? That at the agency director level, right? You do see, right? I thought that's what I heard Cully saying, because, and so pick something that is going to weave across and be very intentional, not just about the good relationship, but the policy and operationalization of it across all of the sectors that are committed to early learning.
Is that feasible though?
Is
I
it
guess that's my question.
What's your question, Kali?
Is it feasible? Is that a feasible thing to do? I don't want to put things up here that aren't so.
Miriam, what do you think? I mean, I think this is difficult, but I know it's for sure hard. That doesn't answer whether it's feasible.
I mean, I think that it should, I mean, I think it's important. It should be. I'm trying to think about if there is a way, that this could be a focus of RUIACT to help operationalize.
That's interesting. So maybe the charge, Miriam, would be RUIAC would have to figure out how they get positioned.
Yeah.
To actually figure, so we could change that up, but give RUIAC the charge.
Yeah.
Their charge is to actually work on this piece.
Right.
That would be a
Because
good
I feel
challenge
like
for them. Yeah.
Yeah. I feel like in the, I feel like in the, I think you heard it. I mean, each agency has different focus, different staff, probably things that could, be learned across from each other, and, brought to be kind of its own lens for the work, right? I mean, for the system, I should say, that is, more developed, I think, kind of collaboratively and across. I mean, I think one of the things that I'm even like conscious of is even across the different sectors, we talk about equity work with different terminology. We have different ways of thinking about it. Like we have different stakeholders, and I think it would just different probably levels of focus around sort of racial justice versus, equity issues, sort of, more broadly. Data capacity is very different, I would say, across. So, ours being probably, or ECE is probably being one of some of the most limited. So I think it would be really, that seems to be maybe to be, an agency, like agency director ask of sort of RUI Act.
Do you want to
Well,
amend your write up, Miriam?
Sure.
And then while you're doing that, Sue and Miriam, do you have other things to add for potential content priorities?
well, I was
We
just
get
going
to
to
money.
add on to this that I think that if the children's cabinet ever starts meeting again, or when it starts meeting again, that would be another venue to
Yeah,
try
that's true.
to promote this at, which would be the agency director level rather than the RUI Act.
Yeah.
That's probably even better
I think
because
so.
it's the governor. Yeah,
The governor's there as well as most of the directors.
right.
And for me,
So
this,
should we amend this to children's cabinet?
yeah, I think,
Yeah.
I'm not sure when it's going to start meeting again. I assume maybe this fall or
Yeah.
sometime. So maybe RUIAC helps set some of the stage for those conversations that could then be taken to the cabinet. So maybe they sort of do some of the groundwork or the thinking of how would we set that conversation up.
Mm-hmm.
So Miriam, I think it's just agency director brings a focus to children's cabinet on shared decision making. And then you can put the same as the other, centering equity could be could be the first, the same as the first one.
Yeah. Yeah.
Yeah.
Okay,
And
so
I think that the pandemic really highlighted for me how different agencies are when it comes to racial equity work, and just even having the language. It seems like small things or the instinct
Mm-hmm.
to like consult with community and understand the importance of cultural communities. Like it's something I think the council and early learning does well. It is not something that others do. Like and I think to systematize it, there has to be, I don't know, someone who leads and who can give examples. Like you have concrete examples. Granted, I hear everything you're saying around there are different levers, different data collection,
Yeah.
but I think you have examples of operationalizing it.
Mm-hmm.
And really a journey of being in the same place just a few years back. I mean, when we had to redo the whole QRIS because of leaving out, like that was a huge undertaking. But I feel like we need to move some of these systems to do more of that work.
Right.
that's great.
So
Other
for me-
content ideas, Sue or Miriam, to add to the list?
Well, this leads me to one that I hope we consider is sort of the governance issue around developing an early learning system. I think we have to start moving in the direction of consolidating early learning programs so that they can have consistent policy and implementation, and to build a system, we just have to be more coordinated than we are now. And I think as long as some of the early childhood programs are in different agencies, we just aren't going to have the focus and get the results that we really need.
So are you thinking in specifically about the early care and education programs?
Yes.
Okay. So
which includes childcare.
Childcare, ERDC, early intervention, Part B, Part C, the childcare subsidy program.
Yes. We just, I mean, we're so underfunded that the idea of having this funding sort of off in different agencies and under different staff, I just don't think that makes any sense.
So
So,
it's interesting, when I was working on the handout for the meeting, one of the things I was thinking about was how the Raise Up Oregon has the 5 sectors: early care and education, human services, housing, health, and K-12. And except one of the interesting observations is 4 of those 5 sectors are separate state agencies and 1 is not. That is to say, early care and education is in fact a division, right? It's a sort of aberrant division in some ways, but the reality is that it's technically a division of ed, whereas the rest of these things, like as a starting point, you know what I'm saying? They're each is its own thing, its own
right.
agency, and then you're
Mhm.
working on the integration. So I think that's interesting that the ELD portion is both incomplete. So I think that speaks to your first point. But I think I would also observe and I do think this does matter in government status wise. It's not on equal footing to the others in its current structure. So I don't know, if that's an additional recommendation here, okay, because that would bring you both to putting like together ECE, but also treating the ECE at the same level, agency level, as the other sectors.
Yeah,
Right.
I'll make that the second
Okay,
part.
Kali, I saw you nodding your head, but
Yeah, I agree. I know that we got more funding than we've ever gotten for early learning in this last session. I know we're headed into a huge budget deficit, but I also think there has to be more dollars in the ECE space, and I don't know how to get it, but I think I I it's just not right. I don't know. I'm trying to think of, like, how do you call the moral question of the importance of that, in a time where the economy is hurting, and I don't even know the sources. Like, you don't one does not want to have to go to the ballot for anything. Like, I'm not suggesting a new campaign. I'm just wondering, how do you get more resource
it's
into
interesting, Kali, because maybe we're moving on, Miriam, to our funding priorities. That's our second
Yeah.
question. But
Oh,
Kali,
okay.
what I was going to say, just by way of experience, and Sue said I could share mine, you know that we created a comprehensive early childhood agency in Pennsylvania that did have everything in it. And even though we had a liberal Democrat governor and we weren't having a recession at the time we did it, he basically was like, by the way, you can't spend any more money to do it. He was just like, you can do this and I will support it. And the reality is we got it done. Okay. And so I think we shouldn't be too afraid, even in a difficult time period, of basically, sort of taking on that which is hard. And so I just wanted to share that because I hear your concern, but I think I might come at, like, if not now, when, like, for, like, you know what I'm saying, like that whole thing, like we're in a period of intense activism about a lot of stuff, so put this on the table because it's a real need.
Mhm. I
And
would I would just say, to add just on this point before we move on, that I think this makes a lot of sense for a conversation or an issue for the council to champion, because it is very difficult for me in my role, or anybody in my role, um, to be able to champion this issue. I think probably to a lesser extent, but also impacted would be, somebody in Colt's role. And so I think that makes a lot of sense. And I also really just feel like part of the frame of this also has to be kind of sustainability and the durability of the changes. And I think, some things that we've seen in our field is that, like, governance structure, it matters for that. I mean, I think Oregon has been
Yeah.
really fortunate to have 2 consecutive governors that have really prioritized this, but that is, not the reality. And I think what we've even seen in some states, that when there is a change in a governor, and it's not like a governor that doesn't oppose it, but doesn't make it needs to be like a singular focus priority to move. Particularly, you see backsliding, I think, and some of the things that we're talking about here. Um, I think are important steps probably to be taken. Again, I echo probably in a budget neutral way, or I think it would be a non-starter. Um,
So
but
I
yeah,
think what you're saying, Miriam, is that it's the ECE is its own separate agency in order to sustain, system development or
yeah,
Yeah,
some.
so Miriam, maybe amend that little talking point there, EC as its own separate agency
mm-hmm,
in order to sustain
mm-hmm, yep,
systems. It's actually both to attain and sustain systems development. It's both
Right.
Can
things.
you make a comment or a note, budget neutral as well on that?
yeah,
Yes, can be budget neutral.
great, yeah,
Yes.
can be budget neutral, great.
Yeah. I
Well,
mean, that shouldn't be an impediment if people say you can do this, right? But without more cash on
Right,
hand.
right.
That shouldn't be a reason to say don't do it.
but what we also know is it's going to take some time to pull that off in some real intentionality. We're going to have a process that sets this up. It, and I don't even know what that is. I know there's a study that you sent me that had all sorts of pieces that go with that one specifically. So
Yeah.
we would just have to be able to, yeah.
And I think a lot of that, like, I also want to note that Oregon is farther ahead than a lot of other states.
Yeah.
And so I think even that report, I mean, I thought there was some really, obviously good to review and things that we can learn, but I think that report is probably in states that even aren't as far along as
That
Oregon.
there's no question about that. Because I think like I'm running through a process very much like the report for Alaska now, but they have nothing in place. Here, you basically were talking about honestly a few sets of actions. There's some remaining programs that would need to come into the ELD. It's not very many, okay, at this point. And then there is the decisional process around making it its own cabinet agency, right? And so, but there's been a lot of work here that I think would accelerate the pace of being able to do this. And then I only want to say, and Miriam is aware of this, the thing I did in Pennsylvania, which is long standing at this point, had zero public process. Zero public process. And we did it extremely quickly. The governor,
That's
it was in the
why.
primary campaign documents for the governors. Both the Democrats put it in when the one won. Basically, we did it extremely rapidly. And so, notwithstanding some of our publications that might say it's whatever, you guys have done a lot. You've done a lot that was public already, and you have a lot in place. And so, my own just experience is there's not a single way to get to these results. It's more that you have to look at what is the result you want to have. And here you've got two missing pieces at this point, right, that hopefully could be embraced by the governor and acted upon.
Okay, great.
So,
wonder too,
Miriam, the way that we have this set up, just when we get to financing, that's a new header. You don't have to, but we have
I
our
was,
next issue is, or do you want to call it, because our next one is funding
I
priorities.
feel like I'm trying to make a distinction to build up something
Okay.
that Kali said earlier, which I thought was just like, I think, but maybe we can tackle it in funding priorities. But I just think about like financing is a, longer term kind of North Star. I mean, it's
I
almost
see what
like,
you're saying. You're
it's
talking
almost like
about
the quality of
scalable funding.
yeah,
Scalable funding. Okay. I didn't
yeah.
understand,
And like
Miriam.
what that, and then obviously there's, I think shorter term, there's prioritizing within, but yeah.
Okay, so your recommendation was a fourth priority,
Hmm.
basically for content, is to keep working on scalable funding,
Hmm.
right? And
Yeah.
getting your resources to the point,
Yeah.
that you actually have enough to do everything you want to do, cover all the
Hmm.
children,
Right.
equitable compensation, equitable system,
Right.
that kind of thing.
Exactly.
Okay,
huge
Okay.
I'm sorry, I misunderstood.
Continue to develop strategy. What did you say? Oh, sorry, Khalid, go ahead.
No, you go. You finish. I'm sorry.
Okay, Harriet, you said to develop a strategy for
For
scalable
sustainable
funding.
scale, for a scalable, funded, equitable system.
Yeah. Okay.
Okay, equitable, system
Yeah.
of services for
Yeah.
children and their families.
Okay.
To not forget who we're trying to serve, right?
Okay. Yeah. All right. Got
Okay.
it.
All right. So
Oh,
now, Miriam, now we have another bullet, and this one is funding priorities.
wait, before we switch to that, I have a
Uh-huh.
question. Does that infrastructure, Miriam, help with the scaling of? I remember talking to you about the fact that like a lot of the providers right now, there's not it's not scaling, it's consolidation of services and service delivery so that things like cleaning services across childcare can be occurring in sort of a consolidated fashion versus this piecemeal everybody does their
Yeah.
own. Would the
Yes.
because I think that was something that struck me, and
Yeah.
I recall hearing from the family care providers that we've worked with, like that's a huge thing. So
Absolutely. Yeah.
I feel like it should be a priority given that we're in a health crisis in particular
Yes.
to be
Exactly.
able to offer some of those
Yeah.
services in a
Absolutely.
centralized way.
Right.
So
That's a good segue. Is that
that's,
our
yeah,
first funding
let's do that
priority?
for a
Yeah.
funding priority
Oh, is that okay?
because, yeah,
I
I
don't know
think,
where they all fit.
and
Yeah.
also they'll get mushed together. We were just trying to, Cully, find a way to help you organize the conversation. You guys are
Okay.
doing a good job because you don't have a large laundry list. You actually have been pretty specific, around items that I predict Sue can brief
Yeah.
us on.
Yeah, but we haven't talked yet about, I mean, I guess this is where childcare is going to show up.
Yeah.
And certainly there's a lot of talk now about how are we going to support the providers to support the children and the behavioral issues that they're probably going to see because of being cooped up for 4 or 5, 6 months.
So one funding priority might be then listening to you. So one funding priority, one way, I don't know if we want to say it this way, but the way it's getting talked about around the country is really the concept of operating supports for the child care providers, right, on health and safety, right, as as one of them and other areas, but to start to recognize. And the other way maybe is we are seeing governors now moving to protect their child care expenditures. There are some governors who are saying they're not going to do any cuts in child care. We definitely, like in my home state, it was not good enough. It was only no cuts in pre-K and Head Start supplemental. And they've reserved the decision on childcare for the moment. But there are definitely, like, believe it or not, Texas, the governor already said there will be no cuts to the childcare budget of all places. So I just, so that was interesting, right? Is like, who would have thought that the governor would have said that?
Mm-hmm.
So that's another way of thinking about that too, that I don't know, whether you all want to, I know Miriam wants to say this, which is protect the early childhood budget, make it a cut-free zone,
Yeah. I'll just put
right?
it. Yeah.
Okay.
I wanted to say something about the also I think covering the operating costs to sort of what you
Yeah.
were saying and what we were talking about, Kali, is it also feels like it's such a different way. It could be done in such a different way of financing that could be really game changing for the ECE sector, because we really do fund on a per child cost basis. And I think something that we're starting to what we could do kind of in these operating grants is to think about like what how to set like provide resources to programs, right, to actually offset kind of some of these costs. And because we target through like usually the eligibility of the child or the family and reimburse on a cost per basis. And so it becomes yet another funding stream and source of funding that is siloed in and I don't think in a way of it and ends up allowing us to leverage, I think, public dollars to think about raising quality kind of overall, because it's, getting it that way, not to get too in the weeds on this, is like still just, getting a portion of your operating costs funded, but maybe not all, and I think leads to just a lot of complications in the field, especially for programs that, are serving economically diverse families. or aren't able to have all of their slots covered by public funds, even if they are serving children and families who would all be eligible for public funds. So, you know, it's a
Well,
different
that
way
makes
of saying
me
what are their actual costs for cleaning or
right,
supplies or rent,
right,
and like what's an appropriate subsidy for that entire program.
It's actually interesting,
right.
Miriam, because you put it in there in a somewhat, I think it's realistic, right? But as you said, somewhat narrow way. In other words, it would be a win to have the state establish an operating support fund for everybody, okay? And that have it be directed towards the public health issues, which are pretty real,
Mhm.
right? And especially, Miriam, if you end up with child staff ratios, right, close to where they are now, do you
Mhm.
see? Then that, right, you could also take this concept and extend that, right, to other key elements. Cully, like you talked about that at the opening, the importance of quality, okay, and
Right.
that quality is a necessity for every child. So you could take this idea and make it into a quality idea too.
So I think that this is going to be controversial, so it may not be politically feasible. But then I think what we ran into with I think it was with SSA and the fact that K-12 could access the dollars for early childhood. Is that right, Miriam?
Mhm. Mhm.
Without any oversight in the
Right.
administration of
Yeah.
the funds, like that has to change. That's problematic. And so it seems like the protection of those dollars, either going directly to early childhood or at least the over, like something that has to change. I don't know. I feel like this is like there should be a disruption of that problem,
Mhm.
because I don't think we'll get to the fidelity that we're looking for if that's not rectified.
So, Cully, what would your proposal be? Is because I think we've moved on to a third area now under funding priorities. In
Is it?
your, yeah, I think so, because I think what I heard you say was that you wanted to end up with an outcome in which any provider who's participating in the provision of early care and education services has some oversight for the public
Yeah.
resources. Okay.
Right.
And I said it
Well,
somewhat more neutrally than you did because I do understand that the issue here is, and so I'm maybe asking the three of you, how explicit do you want to be about the issue with the school districts?
well, we've got K-12 in the council, so I don't
Yeah.
know how explicit, but I think it's a huge issue. I think there's an equity frame on that issue. And
Mm-hmm.
I can say that as someone who spent a lot of time in K-12, and there's a lot of disservice to kids of color in the K-12 system
Yeah.
starting in kindergarten. So like
Yeah.
why would they be just given access? Because like I essentially think they just want the money. But they already have a huge pot of money that, though it's decreasing maybe next year, with zero accountability on equity. So like I rather have dollars tethered to equity for early childhood not being run by the K-12 system. I don't know how to say that other than
Well,
it,
uh,
they don't
okay,
have a track
I have
record.
an idea,
I
guys.
don't want to shame
Okay.
anybody.
All right, Cully, I have an idea. It goes back up to our governance thing. So we highlighted ERDC in Part C and Part B, but
Right.
I know we're being controversial, so I don't know. But we could also say that part of this is districts having separate funding to run the same programs is actually inconsistent with what we just said, consolidate our ECE programs. Okay,
Right.
so Miriam, I
There we
think
go.
you can put this idea right there, okay,
Mhm.
because that's part of the trajectory,
Yep.
right? Is that the
Mhm.
notion that somehow the districts got the right to be separate on the
Mhm.
control of this, and Miriam is aware of this, Cully, but this is not normal in the states where it's not the tradition in the states. Like as a general matter, state pre-K is actually governed by one policy,
Right.
in one place.
Should
And
be.
this
It's
thing that happened
sensible.
is weird. I
Yeah.
will just say, you can't quote me later, but I will just share. It's somewhat anomalous, I think, what happened.
Well, then we can say it's not good practice, or
Yeah, we could
practicing
say
practices would suggest
that.
it's
And just remember, this whole thing's being taped, so it will be on the website. So
Oh,
uh,
okay.
Yes.
Well, I think what I'm trying to say is that we've got a system that I think has demonstrable, I think, impacts from an equity framework in terms of working with diverse communities. The teachers are more diverse. I just feel like I'm coming at it from that lens of how do we ensure our kids of color are going to be served well. They have, I mean, I'm pretty consistent in talking about my concerns of children of color in the K-12 system.
So I think then, Cully, up in C governance and that first one, Miriam, you may want to add an equity issue there as well. In terms of the rationale. After the first one doesn't lend itself to getting results, I think that's part of what Cully is saying, that there's an equity consideration here.
That lend yourself to getting results. Okay.
Yeah.
Equitable service delivery. Okay. Quality.
And then the other thing that came up in the PD, like, or professional development training, I think this is a policy issue more than a funding issue. There has to be, it was addressed this last year, I think, but it was questioned why the limit, how to get in, how you get providers into the pool of being certified to provide training that is worth like steps within early childhood. And there's a lot of barriers to that prevent, I think, culturally specific orgs or trainers to be there. And I think that's really important. And I've looked at this now for a few years. I don't know why the barrier exists. But I do think it needs to be eliminated.
Yeah.
And I've talked to people who, I mean, this is an interesting thing with sort of highly qualified provider, what constitutes in terms of like a trainer. And I spoke with someone who said that they did all the tests and they got the certification requirement in order to deliver the training, but still they were not approved. I wish I could have her testify. I don't know her personally, but I thought and it was a woman of color. And I just felt like this shouldn't be this hard. If someone wants to provide training, what she described was a series of things for someone who was, it seemed had access to resources and was well educated. And I don't necessarily think the best trainers are those with the access to resources and well educated. Like, you could have been a professional in the field for a long time and give very valuable training, and they would never be able to navigate what she described. So I think that there is a bias in the system, I guess. That's my...
Kelly, was what Miriam wrote down good there? She put it under content priorities.
I wasn't watching you right.
So professional learning system must do a better job of reducing barriers for people of color to advance in the profession. So access to training, degrees, credentials, leadership opportunities. Okay. I mean, I think we can get then more in the deep weeds, and we have a lot of opportunity, I think, with our PDG grant, really focused on this to tackle, I think, kind of some of the specific things you were saying around Oro and master trainers and things.
So one thing I want to go back on the D, financing, and the second one where it's reach into communities. Somewhere in this list under financing, I think we need to talk about connecting to the business community and getting their perspective, getting their help, and figuring out what is the long-term financing.
So that, Miriam, I think that would be it'd be 0.4 under D.
Okay, got it.
Okay, so it would be really work with the business community to engage them in developing the financing, right?
Yeah.
So we have 15 minutes left, and I want to make sure in our 15 minutes that we don't have any more funding priorities. And then the other one that is to look at them is what are our key recommendations that you most want to highlight from this to share with the governor. So, Miriam, we could do that like by, you could, highlight them or put them in bold or something.
Okay.
And if that becomes impossible, we don't have to winnow. But those are our two things left, to make sure that there's anything else you want to state about funding priorities, basically, and anything, that's either next year or a little bit further out. And then anything you want to highlight that you think is of really critical importance in this next initial time period.
I have a
So,
question.
yeah, go ahead, Kelly.
Do workforce dollars come into the early learning space at all? Like,
No, so we are like our currently like almost the entirety of our professional learning for birth to five educators, providers, primarily like in childcare, comes working in childcare facilities, comes from the Child Care Development Block Grant and kind of the quality set aside. So we have very, very little state investment. Some of the state investment for probably one of our highest touch TA opportunities for childcare providers is, our focused childcare networks. And, we have been, that took a hit in 2019, but then we got, 12.5 million in the SSA annually.
right.
I think it's still, I almost was going to go there and say that, so to your question around kind of workforce dollars, there may be things that different kind of partnerships that sort of more regional workforce boards are sort of happening kind of more at the community level, but not like anything kind of through the state. And very little, I think, kind of state funding. And, I think in general, that is that, until this is actually a field that pays better, it's kind of, because we know that actually even sadly increasing your degree, even getting a degree, doesn't necessarily mean more pay, right? In ECE, that, it's been a barrier, I think, to probably leveraging more workforce dollars, right? Or even, I think sometimes even like CTE, and, it's like,
Well, that's why I
yeah.
asked. I wondered if workforce, or I don't know, like OWIB's involvement, but it seemed like maybe that's where you could leverage dollars to increase pay.
Yeah.
I'm trying to figure out like how you address that with different resource, and it seems it's a workforce issue to me.
Right.
So, Cully, are you thinking a funding priority is it more about leveraging other streams, or is it more an outcome you want to put a focus on? In other words,
Leverage other
leverage other
streams.
streams. Okay, and to what end? What's most important in terms of leveraging other streams to do what?
For that, my wondering was just about how we increase salaries for.
Okay, fine. Leverage other streams, yeah, funding streams, especially for compensation.
Yeah.
Okay.
And it's been a wondering of mine for a while, why early childhood, like I don't even know if there's an early learning rep or childcare business rep on the OWIB. You know what I mean? Like it's not clear to me the tie with that, because it's a whole different stream.
Right.
Well, workforce development has been, the federal level, right, has had an increasing interest in childcare. And there has been a little bit more movement, and I think a tiny bit more relaxation of the fact that they often want to fund jobs that are high paying, and our jobs aren't high paying. So it's been a conundrum, but there, I think, has been an increasing interest basically in that. But I don't think there's anything yet like a set aside or a explicit reservation around the federal portions of the money Or Miriam,
No.
I don't know, in your state, you don't have
Yeah.
anything like that either.
No, but I think that there's areas to, I mean, I really like the way this is written now because I think it gives us room to both think about that, but I think we can also think about particularly kind of on the benefits piece. I mean, should we be thinking about like health insurance pools and things for providers? It's become a big issue in COVID. So, we know, especially so, maybe some, looking at some of the areas in tax policy. So
Yeah.
I mean, yeah, I think
But
it's going to be a couple of different ways at it. Yeah.
I'd make sure it's for, ECE in general, not just childcare providers, right?
Right. Yeah. Hmm.
Yeah.
Okay. So now you have just a few minutes. Do you want to highlight any of these things that you think are particularly key for the upcoming year? I'm very impressed with the fact that your list is not overly long, but even so, if there is anything you want to make that you really want to call out in the nearest term, effectively.
Ready with my highlighter.
Or you could just say it's all for this coming year, but we don't know exactly what the other groups have said yet either. So it might be helpful to
You
pick,
want us
if you have to winnow.
at this big level, at like
Yeah,
the
at
A,
the big
B, C,
level,
D, E?
Miriam, the A, B,
Yeah.
C, D, E level.
Okay. How many can we?
Whatever you all decide. I mean, this is an impossible task.
Yeah.
So, and your list is pretty short, but if on the other hand, it might be helpful if you do have something that you really think is you've got to focus on for us to highlight it. Basically, or you could say, no, we think this is all for the next year period we have to work on all of this and we want the governor to champion all of this in the next year. Not to get it done, this is to champion it, okay? I'll say something from even though it's impractical, but
Hard for me to pick. Yeah.
the one on D is something that we've said already. Like it's hard. It will feel hard maybe to work on this, but it's something you have to work on to get. And if you aren't working on it, you won't get it. And the same is probably true with the governance. Those are the ones here that might seem the most remote and seem like, well, why would we do this now? But I think we know enough to know that if you don't get going with them, then they can't get going. And the others, I think, when you look at that list, they seem more next steppy. Do you know what I'm saying? They seem more obvious than those two. So you may want to say that or not
So
as you
maybe
talk to
Khalid
the
could
group.
report those out as sort of the longer term, and then some of the
Right.
other ones are like in the next year, kind of.
I mean, governance and financing is
Yeah,
long term, but
yeah.
that has to be
Like
worked
we have
on
to
now.
start planning because we want to see kind of
Yeah.
wins like out 2023, but some of these other pieces are like near term.
Okay.
Is that
Can you share this document with me? Is there a
Yes.
way?
Yeah, that's a good, yeah, they're going to email it to us, but I agree, Miriam, your notes are really great. And so I think then we don't need to wait
these
till we
are
do the
longer term?
consolidation.
Yeah, and then I think you can touch on these other ones as shorter term.
But I'm worried if we say they're longer term, that means nobody's going to talk about them until after the next legislative
No,
session.
things we have to start now, but I think
We don't
aren't like
expect
the
to
wins. We
execute,
don't want
finish
to have. We
them.
don't expect to have a win next year necessarily. I mean, the final finish line next year, but we can have.
So in a way, we're changing the answer to the question because the recommendations, these are all recommendations that you guys think are important. All of them need to be worked on in the coming year. They will not all be achieved in the coming year. But in order to get to any of them, you can't not work on them, right? So we're modifying, in a way, the third question, okay? Or we're saying these all need to be shared because they all need to start and in this next time period.
So say that last part again, Harriet, about priorities. The sentence you just said. We have to start.
Oh, in order, all of them need to be worked on during the coming year. And that while some of them, Miriam, may take longer, right, than a year to achieve, if you don't start to work on them, then you're just putting off getting them, right?
Yeah.
It's not exactly what I said. I probably said it better before.
Right.
Well, I think the other question for me is, as we put all this together, so where does the council fit into this? So we aren't just saying to Miriam, go do all of these things, but
Right.
at some point we've got to talk about what's the council's role in working with the governor to move this agenda forward.
So what kinds of things are you thinking about?
Yeah, I don't know if, we want to have a legislative strategy, for instance, where we really work with the governor, but we work with some of the leadership in the legislature to start talking about this agenda.
Agreed. I think it's going to, I think the next session's going to be really swallowed up by the budget deficit situation. And I think some of the things we wanted to advocate for before were impacted by the fact that SIA took up all the oxygen. So we were able to advocate for things we believed in and, language, but I think it's going to be like that, but this other thing is going to suck up all the air in the room. So I don't know what's realistic I'm not suggesting that we don't, I just don't know that I have the thing counting down. I don't know.
Well, it'll give you a lot to talk about, and it'll be fun to see if the other groups, like how the things you all put on the table now compare to the other ones.
Yes, it will be.
Right?
Yeah.
Yeah.
I'm going to move back inside.
Yeah, they're going to take us back. You guys have a break. We'll work on synthesis.
Right.
Miriam, you're going to send to Remy and to all of us. Yeah, great.
Okay.
Thank you, Miriam,
All
for
right.
taking the
Thanks.
notes.
Sure. Okay.
Bye.
Thank you both. See you in 15 minutes.